A very warm welcome to my channel. Today's topic, as you guys already know, is on the coronavirus update. We have a pandemic in US and all over the world. I'm going to focus on some of the numbers. As of right now, this morning when I checked, it was 2980. Right now it's 3045 with 60 deaths reported on COVID-19. If you want to know more about COVID-19, keep on watching. Please do not forget to subscribe to my channel, Nature Lover. Let's start and discuss about a few things in the beginning. Number one, the SARS-CoV-2. This is the first name that WHO had given this virus. There was a lot of ideas were going around. The reason it was done is because the COVID-19 is similar to genetically to the SARS in China, which happened in 2002. It's very, very genetically similar. Not only that, what we saw was at that time, the transmission happened from bats to rivets, which are like cat-like animals. And then it went to the humans, right? In 2012, when we had MERS, it went from bats to camels and then to humans. So COVID-19 what we are thinking and the researchers are thinking at WHO are that the COVID-19 originated from the bats and went to pangolin. These look like armadillos. Now, pangolins all over the world are taken as very auspicious because their scales are very auspicious, and they are moved from one part of the world to the other, and they believe that this is exactly where the carrier was, and then it came to humans. Now, going with this, what we are seeing is when they researched on the pangolin gene, they found that it was 96% same as the genetic composition of pangolin. So that's the closest animal they can find, and that's why they think that this is from the pangolin that we actually got this. So because of the moving around of this animal, we went all over. Now the next part of the video is going to be focusing on some study. This is actually the first case study that was done by Journal of American Medical Association. Being an American physician, we have to keep ourselves up to date on everything, and we have to read a lot of journals, and the journal that we are kind of looking at today is Journal of American Medical Association. This was supposed to be published on 17th, however, I got it yesterday evening in the mail. This is one of the journals that I always refer to for cases. This is the first case on JAMA. The goal of this study, what was the goal? To identify the novel coronavirus pneumonia cases, the people who got NCIP. So what are we going to look at? We are going to look at the epidemiology and clinical characteristics of these people who were hospitalized. Why? I stress the point hospitalized is they were deadly sick. They were not patients outside of the hospital. These were all admitted to the hospital. So these were the sickest patient that we could get. The study conducted saw patients from January 1st to January 28th in that hospital, and the follow-up of these patients were done on February the 3rd, 2020. Again, 138 patients who were hospitalized are being studied in this for the novel coronavirus, for the NCIP, for the pneumonia-like illness. So this was seen that the median age of the disease was 56. The youngest person in the hospital was 22 years. So we have very, very young population, and the oldest person was 92. So we have a very, very elderly, it's a broad range of people. We did not see any children in this study. Number two, gender. Men were 75 men. Now, we have to realize that some of them were healthcare workers that were already, like in the hospital, they were admitted also. Now, because of the transmission of this from the patients to the healthcare workers, we actually had total 40 healthcare professionals that were admitted. Out of the 138 cases, 40 of them were healthcare workers, which is 29% of the case study. Now, what symptoms did they have? The 3 Fs. I call it the 3F. They were fatal. They had fever, high fever. They had severe fatigue to the extent they could not even walk. The 3 Fs. And then 2 other symptoms was having a dry cough and extreme malaise that was seen in this patient. These are almost the same symptoms as any other viral disease, so it's very confusing for us to know who has COVID-19 and who does not. And unless and until we do testing, we won't know, and this is going to go in a progression that we cannot even think about. So what was seen on these patients? On the CAT scan of the chest, these were done. So this is a picture of a lung. Patchy infiltrates were seen all over the lungs. So in pneumonia, you have like one single patch. Here, throughout the lung, there were various patches that were seen in bilateral lungs. Both the lungs were affected at the same time. In all the patients, they saw the virus was seen in both the lungs. Now, remember that coronavirus, what it does is it goes inside the cell of the lung, and then inside the lung cell it replicates the DNA and gets itself copied multiple times so that all of the cells could be affected. So we are not going to see a patchy little pneumonia here and there. We are going to see devastating lung pictures on the CAT scan, and I have actually seen those CAT scan pictures which were on the JAMA book. These looked exactly like this. It was all over because the coronavirus affects the entire lung. Now, 89% of these people were treated by a common antiviral drug, oseltamivir, which is Tamiflu in the common name. The generic name is different, as I said, but 24% needed high-dose antibiotic, including ceftriaxone, azithromycin, levaquin, etc. And also they needed steroids in high dose as well. 36 of this 138 patients needed ICU transfer because they got deadly sick, so they needed to be transferred to the ICU. So in the ICU, what we saw, and in the general case, we saw that 61% went into acute respiratory distress syndrome, or ARDS. This is very fatal. ARDS is very fatal. When we have a patient in the ICU, in the intensive care ICU, and the nurses tell us the patient has ARDS, our alertness goes up. So you can imagine 61% went into ARDS. 44% of this patient had gone into an abnormal rhythm of the heart called arrhythmia. So it also affected the heart. We don't know exactly how that was caused, but we know that they went into an abnormal heart rhythm. 30% of these people went into a septic shock. So this is the deadly picture that we are seeing in patients. So from starting of the disease, the shortness of breath started on a median of 5 days, and from the starting to hospitalization was seen in 7 days for these 138 patients. So these people, for the first 4 days were asymptomatic. They were not having symptoms, which is quite dangerous because these people are going around without feeling very sick. They are going around and doing their routine jobs. So on the ICU, we saw that these people were definitely affected more by ARDS was the older population, anybody who was immunocompromised, diabetes, HIV population, any kind of chronic diseases of heart disease or pulmonary hypertension. Of course, those were seen that the chronic population definitely was had to be transferred to the ICU as they were not able to fight the case. The next thing that we are going to see is those 36 ICU patients. Out of that, 15 patients needed oxygen via either a nasal cannula or they needed a mask. However, 17% patients needed ventilation long term. They were intubated and they needed ventilation because they were deadly sick. On February 3rd, 47 people out of those 138 were discharged. 6 people died, which is 4.3% mortality rate, and the rest were still hospitalized, and the median day of hospitalization stay is 10 days. So as you can see, the important thing that we have to consider is across United States, we have 100,000 ICU beds. Those beds are already full because we had a course of swine flu H1N1 is going around, so those beds are already full. However, what we are going to see is all these people, out of that, a huge amount of cases are going to need artificial ventilation. If we do not prepare ourselves for the artificial ventilation and for ICU setup, we are going towards a huge morbidity and mortality rate. I'm going to keep yourself abreast. I hope you like the video. If you like the video, please do not forget to subscribe because I'll be notifying every 48 hours to the best of my ability. And please, 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 if you like the video, give a thumbs up. If you did not like the video, give a thumbs down, and please sign on the notification bell.